Everybody is so focused on wellness and longevity and brain health and gut health and body health for adults, as they should be. But I think so many people don't realize that if you start these healthy habits early on in life, even with newborns and young children, you don't have to play catch up as an adult like I'm doing right now,
Exactly.
right?
Same,
Trying
girl.
to
Yes.
make sure that
Amen.
all of my health and nutrition is where it should be for my age.
Amen. I appreciate you saying that. Officially, I'm going to welcome you, Dr. Tanya Altman, pediatrician, parenting, and child health expert, and also a member of the Cure Hydration Medical Advisory Board. Thank you so much for
Thank you
joining
for
me.
having me.
That's a fascinating point that you just raised. And it's interesting that I'm a woman of a certain age and now just entering this conversation around perimenopause and menopause and gathering all of this information that I wish I had in my 20s and 30s, because as we're learning, the earlier you prepare for these life stages, the better suited you are, right? You're setting yourself up for success way in advance. But you just make a really good point, which is, why are we talking about 20s and 30s? We should start creating good habits and addressing certain types of health states as children, because then sleep is another one. It's a huge thing for me. If we can create good habits and good practices, the earlier in life, the better, will set us up for success.
You are absolutely right. And it's never too early to start. And it's also never too late to start. I'm on the same life stage as you are. But I see so many teenagers in my office, teenage girls specifically, that are fatigued and dizzy. And especially since the pandemic, might be having some lightheadedness and even passing out. And sometimes it's a post-COVID syndrome or a POTS. And there's so much we can do in lifestyle medicine to really just help them be healthier and feel better, not only now, but it will also help them in the future as they get older, go through the stages that we're in right now that you were just mentioning.
So I was saying too, just before we started recording, I haven't done any podcast episodes on parenting or pediatric health or childhood into teenage and adolescent health, primarily because I don't have children and is not something that weighs heavily on me. However, going back to what we just said, the earlier you start these things, the better. So I'm going to turn a new page, and now I'm probably going to do exclusively focused on raising healthy kids, because that can only help them set them up later in life. But as you're talking, I remember being 13, 14, 15, where I all of a sudden was just feeling completely betrayed by my body. I was one of those teenage girls that had like horrible periods. Like I had to stay home from school because I couldn't function out in the world. And knowing what we know now, it's just amazing to me how little we knew then and how valuable this information would have been to us as teenagers, and also to our parents, who were probably like, oh my God, what do I even do with this girl? It's like, it's a gift to have it now, but it's also such a shame to me.
It is. And I think more information is accessible now. They didn't have
Yeah,
amazing podcasts like yours back then, unless our parents went to the library
right.
and read a book or talked to our own pediatrician
They
or
didn't even know what
physician.
questions to ask. Oh,
Exactly, exactly. And it was like, oh, just suck it up. You'll be fine. I was like that when I was your age too. You'll
right.
get over it. And we realized that kids and teens, especially, don't have to suffer. There is so much we can do now to help them feel better and be happier and healthier, not only for that awkward middle school era, but also to carry on through high school, college, and adult life.
Yeah, it's really amazing. I'm happy you're here. We're going to dive into some fun stuff today that I think is probably just as relevant for the kiddos as it is for the adults who are raising them, but also for ourselves as adults. Something I think we overlook because it feels like a non-issue, but something that I know you spend a lot of time on in your practice and is an area of focus, is this concept of dehydration, right? Which feels like a very easily brushed aside. Oh yeah, that's not really a thing. But actually, as I'm doing my research and have already done a deep dive in some of these areas, it's actually a huge thing. And I would love for you to talk about it just in terms of why it's important to even understand what dehydration is all about and what the implications are when there's so many different systems that being dehydrated impacts. So can you talk a little bit about like why this is an area of specific focus for you?
Definitely. And right before that, I just wanted to jump onto something you said about as an adult. It's really interesting because I have a lot of books I've written for kids, like What to Feed Your Baby. And when parents read these and read my guidelines on hydration and what to eat every day, they say, gosh, I should be following this myself as well. And so a lot of these things can be ever present and important no matter what age you are. And that comes to hydration as well. And although you might hear with infants, everybody says they don't need extra water, they only need breast milk or formula. As you get older and you start eating a more solid food diet, which starts at 6 months of age, because now we want to give all kids all those healthy adult allergenic foods early on to prevent allergies and for the gut microbiome, that's when hydration really does play a role. And I see so many preschoolers, elementary schoolers, and high schoolers that just aren't getting enough hydration every day. And as we know, our body is mainly made up of water. And so hydration is so important. And when you're not getting enough fluids, it can cause headaches. It can cause electrolyte imbalances. It can make it harder to focus and concentrate at school. You can't exercise to your fullest potential. And athletes today, we have so many athletes now that I see in my practice. I have a lot of professional athletes, and they often lead to having kid athletes, right? Like my own kids aren't going to be professional athletes just based on their genes, but many of my patients are, and hydration is really key. And so I'm talking to all my families about carrying that water bottle around, which luckily is so cool now, those refillable water bottles that all the kids carry with them everywhere. And you don't want to wait until you're thirsty and you're feeling tired and overheated. You want to make sure that you're hydrated before you start showing signs of dehydration. And water, plain water, is really one of the best beverages that I love to get all babies over 6 months of age and toddlers used to drinking. But as you get older, electrolytes really do play an important role. And that's why I'm on the Cure advisory board. And we took Cure, which is one of the top oral rehydration solutions for adults, and made a kids version.
Yeah, I saw
And
that. Cool.
the reason why I really like Cure Kids is that it's based on the World Health Organization oral rehydration solution. So there's actually science behind it. So we know that it has the right amount of everything that it needs. It tastes good. It doesn't have added sugar or artificial colors or flavors, which you're hearing a lot about now, because we're really trying to get that all out of all kids' beverages and kids' snacks and even treats that your family may have once in a while. And so it just has what's needed. It's coconut water based, which is so important, and it tastes good. And so in my office right now, we're in the winter, and I'm seeing so many illnesses, especially, and I'm asking all my patients to please add a packet of Cure Kids to the water bottle that their kids are drinking every day to just help hydrate them, to help fight all these illnesses going around. But as we head into spring and summer, where we're getting more outdoor activity and the heat's coming, especially where I am right now in Southern California, and where you currently are in Austin, Texas, you do need that extra hydration throughout the day. And that's just so important for your brain and body to function properly.
Okay, but I'm going to time out right there, because that's all super, super valuable. But even before we get to the replenishment and the electrolyte and all of that, I just want to go back, and I probably will do this a few times in the conversation, just because I'm still marveling at how much more information is available now than when we were kids. But like, we didn't have a water bottle, like bottled water didn't exist. Okay. Like I remember Evian kind of came on the scene when I was in like 7th grade or something. So I'm thinking back to being 4, 5, 6 and running around like crazy, recess, gym, playtime, whatever. And we went to the water fountain in the hallway. And I remember we had to raise our hands to leave the classroom and go to the water fountain. And that happened approximately twice a day or something like that. I'm just sitting here. What would have happened? Could we all have been superheroes if we had hydrated according to the guidelines that didn't really exist for us back then, the way that kids are being encouraged to do that now? Like, we could have been so much more. We could have probably grown another 6 inches. We would have slept better. I think I was like chronically constipated as a child, but had no idea that was a thing. Like, it's unbelievable to me that even just something as simple as like, I see little kids, babies drinking water, little toddlers asking for water. I don't remember drinking water as a kid. Like, I had a healthy lifestyle in my house. We weren't like a junk food house, but we just didn't talk about this.
We also drank out of the water hose in the front yard, right? When we were running around playing with our friends, and kids don't do that anymore. And maybe it's because of the environmental contaminants that the water hose isn't necessarily the best source of fluid anymore. So we all have the water spout filters in our house and the bottled water, but we're trying to limit plastics and microplastics. And so you have your water bottle there. I have mine too. And
just having this conversation is making me thirsty.
I know I'm cold right now. So I have my Ember mug here because I like to have my warm water all day long since I'm old now.
Mine's room temp. I will say that. I can't drink cold water anymore. I like a room temp. If it's warm, then I've got to put like lemon juice in it or something. I can't just drink like plain warm water. But anyway, I don't mean to divert the conversation totally, but it is fascinating to me that it's such a simple thing. It's obviously the basis of human existence is being able to replenish the water in the system. But it's amazing to me that we're actually okay. We survived.
You also have to remember that life was different back then. We didn't have screens. We slept more. We spent more time outdoors. We ate healthier, good nutrition.
Yes.
And even families that are really focused on good nutrition now, there isn't as much vitamins and micronutrients in the vegetables and the fruit as when we were kids, unfortunately, just due to this generational depletion in the soil and in all the contaminants we're getting in the environment around us. And that's why we're focused now. The pendulum swings back and forth to good nutrition in our patients and families. Interestingly enough, as an integrative pediatrician, over the last 6 months, because I've been having so many patients come to me with so many issues, as I mentioned before, like the teenage girls with the dizziness and the autonomic dysfunction and the POTS post-COVID. And
wait, can you explain what that acronym is? Because I'm not familiar with it.
Yes, postural orthostatic hypotension. So we're seeing a lot more teenagers and adults now post-COVID, post other viruses. They are just dizzy. They are brain fogged. They are fatigued. They are passing out when they're exercising. And of course, it's so important to do the full medical evaluation, and that often includes a cardiac and a neurology evaluation. But often these families come to me and they say, we've been to every medical doctor we could find and no one could help. And my child just doesn't feel normal. There's something going on. And so one of the new things that I've been doing in my practice over the last 6 months is micronutrient testing. And although I don't love poking kids if they don't need to be poked and drawing blood because it can be traumatic and we don't want to do anything invasive if we don't need to, when nothing else has helped, I've started doing micronutrient testing in my practice. And it's so interesting to me to see the results and see how deficient many of these kids or teens are in certain essential micronutrients that I don't know if we were deficient when we were growing up, or we just managed to get enough of it in our diet, or we didn't have these other external illness factors that cause these symptoms. But I'm finding that when I really study the diet of my patients and their lab values, and then I focus on really ramping up their nutrition and supplements to help with their deficiencies, how a few weeks later they come back and they say, wow, I feel like myself again. I no longer have brain fog. I'm no longer dizzy in class. I'm no longer passing out in sports. And it's life-changing. And my sample size is very small, so I'm not suggesting that everyone goes and gets their blood tested for every micronutrient. But as a physician, when you have patients that you just can't fix, you have to keep looking into other things, right, to figure out what's going on with them. And I do find that so much of this does go back to the hydration status and the nutrition status and the micronutrient status of my patients, along with sleep and exercise and decreasing screens and mindfulness and overall wellness. I feel like so many of my medical doctor friends laugh now and they're like, oh my gosh, you became such a woo doctor. But this is what the patients need nowadays, and it really helps them. And I've converted so many of my hardcore Western medicine doctor friends to some of these more integrative tools that I have been doing in my practice because it really helps.
Yeah, no, that's such a good point. And God, girl, you are so far from woo compared to some of the people I talk to up in here. But it does make me think about, so I had an interview a few months ago with Dr. Michael Bruce, who is best known as like a sleep expert, the sleep doctor. But his book is called Drink, Breathe, Sleep. And it's literally, these are the 3 most important pillars of wellness. Starting from this, these are the fundamental foundational elements of living well. And it's all that stuff it's, first of all, it's intuitive. And second of all, it's that simple. If you know how to properly control your breath and monitor your breath and make sure that you are breathing full breaths when you need to, and also then practice different types of breath work depending on the situation you're in, that's going to set you up for success. Sleep is obviously a huge one for him. It's also a huge one for me. And we went deep on that. And then hydration is the other thing for him, which is nobody thinks about this stuff, all of the things that we're talking about, but it has such a profound impact. Yes, the nutrition piece is obviously just the next step beyond it, but without that first fundamental of hydration, you're screwed. And it is amazing how pervasive it is across all these elements of health. And Yeah, starting those habits early is amazing. But no, this is not woo. This is just
Basic
basic
science and
survival.
medicine and wellness. And honestly, this is how my grandfather practiced medicine back then. Unfortunately, in today's busy medical insurance-based system, doctors don't have time anymore because insurance companies won't allow them to spend a full hour doing a physical. Like I luckily have the opportunity in my practice to really delve into sleep habits, mindfulness, exercise, nutrition, and that is all so important. And especially sleep, I'm really big on getting infants and toddlers and kids to have good sleep habits when they're young because I really feel like that will carry throughout your entire life. And I know that can even be controversial on its own. My boys have always been good sleepers. And when my patients are also good sleepers, when you put your kids to bed and they get 11 hours of sleep when they're young, and then of course, as they get older, it gets a little bit less, but they learn that they need that sleep. And so I love when my older kids and my teenage patients come in and they say, the last few nights I was up late studying, but I know I need to catch up on that sleep. And tonight I'm going to go to bed at 8 o'clock so I can catch up on that sleep. I always talk to my kids, my older elementary school and teenage patients about this sleep deprivation. And when you get less than 8 or 9 hours of sleep a night, if you don't catch up that weekend, I always say you have a week to catch up on that missed sleep, or it stacks up in your brain as this sleep deprivation that you could never get back.
Yeah.
And so I think when I instill that into them, even my college students will say, I remember you telling me that I need to catch up on that sleep. So I make sure that a few nights a week at least, I am calm. I do my meditation. I go to sleep early and then I sleep in on the weekends to make up for those nights when I am out with my friends or my sorority or my fraternity or up late in the library studying at night. And I love that they remember that.
No, it's great. I recently did a sleep coaching certification and we spent quite a bit of time on just the difference in the needs of the sleep needs depending on life stage. And it's funny because everybody gives their teenagers a hard time for sleeping so much, but it was fascinating to learn how much sleep they actually require. And even just in terms of their circadian rhythms, like they are designed and wired to stay up a little bit later and sleep in. And even though it seems as a parent or a family member seeing a kid that's still in bed at 10 a.m., you're like, ugh, God, that's just lazy and not motivated. The reality is they actually need it. So number one, I would say that if it's available, then that should be encouraged. Second point that I want to make is because to your point, a lot of this is controversial. And I think especially when you're talking about parents of younger children, to some degree, a parent will say like, whatever works within the confines of what's reasonable is what I'm going to do because it's keeping them sleeping. And we're talking about little kids, babies and toddlers and little ones. However, I did mention in a post that I wrote in my newsletter a little while ago, I'm very anti-melatonin, and this is just my personal position from my own personal experience, as well as the research that I have accumulated in my sleep studies. But it's a very polarizing topic. There are medical doctors who encourage it within certain regulated use, and others who are like never except for jet lag, which is where I fall into. But I know that like melatonin for kids is something that people can look to as a solution. The post that I wrote was like, there are alternatives. You can do valerian, you can do other types of roots and herbs that are not necessarily inhibiting your own body's production. I'm not a doctor and I'm also not a parent. So I feel like maybe I'm out of my lane when I make a recommendation like that. You are both of those things. So I would like to ask your opinion, which is simply your personal perspective, but I would love to hear it.
Yeah, and I don't think you're out of your lane at all. I think, yes, general wellness, we do not want to use external medications, supplements such as melatonin, unless absolutely needed, right? So we would work on decreasing screen time the 2 hours before bed, making sure kids are getting enough exercise, having a calming bedtime routine that's consistent every night. Now, there are some cases, especially in kids that might have developmental or behavioral issues, or we're trying to reset that circadian rhythm, where I will sometimes use a low dose for a few days to 1 week consistently, along with all of the other routines, and then get them off. But I do also like some of the other things you mentioned, like the chamomile tea can be very relaxing as well, L-theanine for my teenagers. So I think Usually I prefer not to use melatonin. I won't say it's an absolute no though, because as a medical doctor, there may be sometimes we do need to use that as a tool in our toolbox. But in general, that is not something that I want my families to rely on a regular basis. So I do agree with you there. And I think sleep habits and routines are really the best thing when it comes to just setting up your sleep routine to sleep all the way through the night. Yeah. And nobody's perfect. As we were talking about this, I was thinking like, oh my gosh, last night in my house, something that I would never recommend to parents happened. So all my boys were very good sleepers. They all go to sleep at time. They wake up, they sleep all night, they wake up in the morning. And my 10-year-old, for example, is really like an 8:30 to 7 a.m. sleeper. And I have my families arrange their house so you can wake up and get out of that door in 30 minutes. Because as we mentioned, sleeping in is really important for kids. And last night, for whatever reason, my son could not sleep. He kept coming into my room crying that he had headaches. He was having a hard night sleeping. My husband happened to be out of town. I had him come in bed with me. I rubbed his head. We were both
all the things you're not supposed to do.
All the things that you're not supposed to do. But again, it's like the 80-20 rule, right? If you do something 80% of the time, you know, that 20% of the time where things go differently, you're traveling, you're up late, someone's getting sick, you will get back to sleeping. But we had to get through the night. I had a very busy day today. Before I got on your podcast, I saw 4 illnesses, and then I have more patients and meetings. And I was all night thinking, I just have to get to sleep because I have to get up in the morning. And he was very tired this morning, but we gave him the healthy breakfast, did our morning routine. I dropped him off at school, and I'm like, tonight will be different.
Yeah. Oh, yeah. But you're totally right. 80-20, like you do what you have to do. And if you're successful 80% of the time, fantastic. And that 20% can be reserved for special occasions where you just need somebody to give you a tummy rub or whatever.
It happens to all of us. And you just do what you got to do in that moment. And then you'll get back on track the next day, and that's okay.
Yeah. The only other postscript I will add to the melatonin conversation, and thank you again, I really appreciate your input on it, is the other warning that I put out there is just, unfortunately, because of the way that our current supplement regulation system is set up, you often don't know what you're getting. And I feel like that's a risk for adults, let alone it is for kids. So unless you know for sure, and you've like double and triple checked against all of those resources out there, that the label that you have is delivering what it says it's delivering and not substantially less, but in the worst case scenario, substantially more melatonin. That is also why I say maybe try to avoid it, because it's scary out there.
It is. And that's unfortunately true for the entire supplement industry. Yeah. And as an integrative pediatrician, I do use a lot of supplements, and I really try to choose companies that I know do testing and extra certifications and are high quality. I really like the Clean Label Project when it comes to looking for supplements and products for young kids, because they don't test for the amount of nutrition, but they test for over 400 contaminants, plasticizers, toxins, chemicals, heavy metals, things that we really want to make sure are not in our kids' products. So when you're looking for baby food, infant formula, supplements, hydration, all of that, I do look to the Clean Label Project. But I think we need more companies that actually test for the amount of supplements and the amount of nutrition in the products. And I've been thinking about this. Is there a super score we can have for baby food and supplements and kids products where it balances all the things you don't want with all the things you do want? And that's something that we don't really have a great way to test for yet, and we do need.
Yeah, no, that's a great point. And if you want to start that coalition, I'll stand behind you, back it up. So let's go back to the other direction, which is, again, we're meeting basic needs. So we've talked about sleep. Going back to the hydration question, again, because first of all, because we're still in like peak illness season. We're talking about, we've still got flu going around. We've still got norovirus and all of these like scary things. So how are kids and even adults, but like, how are we managing these things when it comes to staying healthy? But then once we potentially have these illnesses, like, what do we need to be doing to safeguard ourselves and to set ourselves up? Because especially with norovirus, what I've learned firsthand, because I think my husband had it a couple of weeks ago, once you're in it, there's nothing you can do. You just have to ride it out.
Yes, so clearly preventing getting sick is key. But when you do get sick, which happens to all of us, even as a pediatrician, although I feel like I have a really strong immune system and I rarely get sick, once a year, something will knock me out. And so every day in my practice, when I'm seeing kids that are sick, whether it's vomiting and diarrhea, or they have really bad runny noses, cough, congestion, fever, we talk about the importance of hydration, the importance of getting some extra fluids and electrolytes every day to really hydrate your body to help fight off those illnesses. Also, I love nasal saline. I'm teaching my patients every day how to just flush all that mucus out of their nose when they're sick. And I know that can be so hard for many to do, but there was a really good study out of Europe a few months ago that I talked about on social media, that by using hypertonic saline, which means get those saline bottles and fill them up 3/4 of the way with distilled water and then put the sinus rinse packet in. If you flush all that mucus out of your nose a few times a day, it will not only decrease the chance of you getting a sinus infection or secondary infection, it will get rid of the virus and you will get better 2 days faster from that's your nasal viral illness.
Can you say that again? Because that's like a huge nugget.
Yes. So nasal sinus rinses, no matter what kind you use. Now, clearly the sinus rinses where it goes in one side and out the other, or the neti pots are the best, but even a nasal saline spray bottle for younger kids, if you can flush all that mucus out with a slightly more concentrated nasal saline salt packet, it can decrease the duration of your illness by 2 days. In addition to helping you feel better, breathe better, sleep better because you're not as congested, and decrease the chance of getting that secondary sinus or ear infection. So that is something that is very natural and very safe that I teach all my patients of all ages to do. So we do that, we hydrate, we do lots of good nutrition, vitamin C, vitamin D, zinc, echinacea, all of that in nutrition if you can, but otherwise we often use some supplements, especially when you're sick, and even on a regular basis to help prevent illness. But that's something that I'm talking about every single patient. And it depends on the age, because supplements all depend on the age. And with kids, I always tell parents, because parents will say to me, what's the best supplement of XYZ that I can get my child? And I say, whatever they'll take. And it's not a battle. So we taste test vitamins and supplements in my office all day long, because you could buy the best quality, but if it sits in your cupboard, same with fruits and vegetables and nutrition, right? If your kids refuse to eat it, it's not going to help them. So everything has to be good tasting and easy to take for kids. And that's one of the reasons why Cure Kids is so easy to throw in their water bottle when they're sick once a day, to just give them that extra good tasting hydration and extra electrolytes that we all need to help fight illnesses.
And does that, I'm not familiar with the kids, but I am familiar with the original packet. Does it also have, I know it has the coconut water base, does it also have magnesium and potassium and sodium? What's the balance of nutrients?
Yes, those are all the key electrolytes that you need when, not only when you're sick, but just to stay hydrated on a regular basis. So essentially Cure Kids is roughly about half of the adult electrolyte packet. And what's interesting is when I work with companies to help formulate, whether it's supplements, hydration packets, or other types of nutrition and food supplements for kids, it does end up being about half of the adults. We do dose it down by weight in most cases, and of course it varies. But so if you don't have the Cure Kids in your house and you have any adult electrolyte packet, again, I love if it's clean label tested, if it's an official ORS, oral rehydration solution, that it is approved by the WHO and really based on their scientific formula that you need when you need to be rehydrated, especially if you have vomiting, diarrhea, norovirus, as you mentioned, your husband did. You can use an adult one and give kids about half, and that would work as well. But if you have the ability to get something that's formulated specifically for kids, I think it is always a better option.
Yeah. And just to be clear, this is not your mama's Pedialyte. Like, this is a much cleaner formula. This is not the refined sugar and all the crap that's in, sorry, Pedialyte, but it's time for a little bit of an evolution there. And I'm a big fan of that brand and product, and I've known founder for years, and it's a great, it's a great product. We're not here to sell it, but I am a big believer in what they're doing. On this tip, what is dehydration? If a child is really too young to express what's going on with them in clear terms, like, What are some of the signs to look for? And then a secondary question there is, what else could it be misinterpreted as? Oftentimes, I think there are misdiagnoses for adults as well, because it's just we're not thinking holistically. And if you have stomach pain, then you're like, oh, there's something wrong with my stomach. Reality, you might be dehydrated, for example. So like, how else does it present where a parent or even, an adult for themselves can be looking, and maybe that's not the first obvious thing?
And that's a great question and so important. So in little kids and babies, we look for fewer wet diapers. If kids aren't having tears when they're crying, when babies come into my office and they're sick, like I'll always say to parents, oh, look, their lips and their mucous membranes in their mouth are really moist. That's a good sign of hydration. So if there's no tears, decreased wet diapers, their mouth and lips and tongue are dry, they're acting either more lethargic or more fussy and irritable, that can be a sign of dehydration. In older kids, again, less urine output. So I'll say, how many times did you go pee today? And if they don't remember when the last time was, and they're sick or they've been running around a lot, that can be a sign that they're dehydrated. But also it can be a sign of other illnesses, which is why it's really important to keep in touch with your pediatrician, because while in many of these cases, the kids do just need more hydration, we don't want to miss something else that's more serious, such as diabetes or another illness, which can also present as lethargy or dehydration. Although usually with diabetes, we'll be seeing kids are really thirsty and they're having more urine output at the beginning, but then after that, it can go the other way. So again, when your kids aren't feeling well, make sure you know the signs to take them to your pediatrician's office for an evaluation. And that would be if they're really not acting like themselves, if they're not bouncing back quickly after that little bit of hydration or that fever reducer that you give them. Trust your gut as a parent, because you know when something is not right.
Yeah, that's good advice. One more question on the supplement tip, because now I'm just curious. We grew up in an era of Flintstones, right? There was one multivitamin that existed, and now I know that there's just like a plethora of different options. And the gummy thing is like a little controversial just because some people feel like, I don't want my kid just like eating more sugar. However, to your point, if it's the only thing that they'll take, then that's the better way to go. I'm more curious on a macro level, are multivitamins actually as beneficial as they purport to be, or is it better to take individual of those nutrients? Does every kid need the same amount of zinc that's found in a multivitamin? Just as an example, is a multivitamin as multi-purpose as it claims to be, or how should we think about that?
It's always best to get all of your vitamins and nutrients from food. So as much as you can give your children healthy, whole food. Eggs for breakfast in the morning, right, is a great source of protein. Fresh fruits and vegetables throughout the day, omegas from fish, lean protein sources, calcium from dairy products. But again, we know that some kids are picky and it's hard for them to get everything in. So I've always been a fan of, unless your child really has a well-rounded diet, that a good quality multivitamin is okay to give them that little bit of extra. During the pandemic, we started seeing illnesses and diseases that we had never seen before due to lack of nutrition in kids. And it was mainly in kids that also had some developmental delays or issues, but we were seeing things like scurvy, which you wouldn't normally see because kids usually eat enough fruits and vegetables that they're getting enough vitamin C. But we would have patients presenting with bleeding gums and bruising, and it hurt to walk, and it looked like leukemia. But then we realized it was a child with autism or a delay that was only eating French toast every day during the pandemic, just because everybody was so busy and so stressed, and parents were just making what they liked every day. And you don't realize that if you don't have fruits and vegetables in your diet, there are so many things you're going to be lacking. And that's when I realized everybody just needs a multivitamin again. Yeah. So I will never now tell a parent not to give a child a multivitamin. Now, that said, not all vitamin quality and the amounts of each nutrient are the same in any of them. And so we could pick them all apart. And when kids are sick, yes, they usually do need extra vitamin C, extra vitamin D, extra zinc. But if you do nothing else, sometimes just giving an extra multivitamin can be helpful to your child, whatever the age is, if anything, for that extra bit of vitamin D. And when I'm really meeting with my families and we go through their entire diet and nutrition history of their family, I try to make it as easy and user-friendly as possible. So there's some cases where I'll say, you know what? you're doing a pretty good job with your child's diet. Let's just do a multivitamin a day. And there's going to be some families where I'm like, your child really isn't drinking milk. They're getting sick a lot. I think they need a higher dose of vitamin D. I want them to take 1,000 or 2,000 international units a day. And this is how you can get it for them. Your child is really not getting any fish in their diet and they're having some focusing and concentrating issues at school. I think they need extra omegas. So we're going to have to find a special different omega supplement. And it's so personalized and unique based on what your child's issues or challenges are and what their diet and nutrition currently is and what they're willing to take, that we may have to be a little more personalized with some individual vitamins. Or if I do micronutrient testing, sometimes I find that my migraine patients are low in riboflavin. They're going to need that specific B vitamin on its own because even taking a B complex is not going to get them enough to get their level up to what it should be, which may only take a few months to raise up. And then we're going back to a B complex or multivitamin, in addition to adding so many more fruits and vegetables and colorful rainbows to their plate every day.
Oh, this is like exciting and interesting to me, just being a fly on the wall for these conversations because I haven't been in it. But while you're talking, I'm thinking of a handful of friends of mine who have kids that are very picky. This one only eats white food. This one only, and which is common, certainly. But hearing what you're saying and thinking about these deficiencies, then I'm taking it a step further because I'm wellness food girl. And so I'm also thinking beyond the supplements and that. What do you say about if there's a kid who literally just won't eat any kind of vegetable, even if it's like hiding in something, are greens powders or anything like that something that you look to? Do you feel like that has the replenishment that they need, or do we go a totally different direction with a kid like that?
Yeah, I think when I work with picky kids, I think the goal is to try to work them up to eating real fruits and vegetables. So we'll have parents take them to the farmer's market and get them involved with cooking and let them pick a new meal we're going to make, even if it's a veggie lasagna named after them, and have them put everything in there or throw it all into the smoothie. And even if they don't eat it for the first few weeks, by the fourth week of making that smoothie and having everyone else in the family taste it and say, yum, they may eventually start to taste it and like it. So exposing them to the real foods would always be my first goal. But in the meantime, we do have to get that nutrition into them. So yes, sometimes we will work with blending and powders and gummy supplements just to get them the nutrition that they can get. The ultimate goal is working towards getting everyone to actually eat the real food at the table with the rest of their family.
Yeah, I like that. So it's really more of a behavioral approach, which totally makes sense. And if you get excited about whatever it is that you've got that you can present, then I think it does encourage more interest in it. So that's cool.
I think you mentioned before, you talked about constipation, and that's something that I work a lot with. And if you look at my What to Feed Your Baby book, which is old, I need to update it, but it's my 11 essential foods that you should get all babies used to eating between 6 and 12 months of age and then continue regularly in their diet through adulthood. And prunes. Prunes is one of my top important foods that I like all infants and kids to eat every day because it is so good for constipation. Hydration also can help with that, and more fruits and vegetables. But one of the things that I think a lot of families don't realize is a lot of the processed foods that families often will gravitate to now and sometimes some of the plant-based processed foods, which I hate to say because I love a plant-forward diet, they have a lot of gums and fillers and thickeners and emulsifiers, and that all causes constipation too. And so we really try to clean a lot of that out of the diet, more prunes, more fruits, more vegetables, more fluids. And then we'll also often work on the gut microbiome and restoring that. And I sometimes do gut microbiome testing in my patients when that's needed as well. But I think if I had to choose one food, and would this be a fruit or a vegetable even? I guess it's a fruit, right? Because it's a dried plum. To get all young kids used to eating every day it would be prunes.
That's amazing.
And they're yummy. They're giant raisins. They taste good. They're dried fruit. And it is so easy when kids come home from school and say, I have a tummy ache and they haven't gone to the bathroom, to give them prunes. But when I say, will they eat prunes? And the parents say, ooh, and the kids say, ooh, and nobody in the house eats them, then you're stuck. So get your kids used to drinking plain water, and eating prunes at a young age, and that
Yeah.
will help solve and prevent a lot of
Everybody should be eating prunes. What is it about prunes specifically? I mean, there's dried fruit, but you can get dried apricots, you can get dried peaches. What is it about the dried plum that is that specific to our systems?
It has more fiber and all of the good things that your intestines and gut need to just help push all of that stuff right through and come out the other end. To simplify it.
Yep. Okay.
It has to do
Gotcha.
with the types of sugar and fiber
Yeah.
in there and how it pulls more of the fluid into the gut and softens the stools. But it is so
Prunes are
useful. I
delicious.
travel with the little individual dried prunes
Yeah.
or dried plums or prunes when I travel with my family on vacation, because inevitably when you go on vacation, that's when everybody comes back constipated.
Ready. Yes. Because of the airplane, because of the different food, all of the things. Yes. This is definitely an area of particular interest and fascination for me. Okay, we're running out of time, and I want to be mindful of your time because obviously I know you've got a stacked day with patients, et cetera. But I want to make sure, is there anything that you feel like you want to drive home? I feel like there's been some really incredible talking points and things to remember already, but I want to make sure we've covered what you want to cover in this important discussion.
Yeah, I think the important message is that you can start healthy habits with your kids at a very young age. And there may be some time where they decide they don't want to listen and follow you. But as long as you keep offering them the water, offering them the electrolyte solution, offering them the fruits and vegetables, and keep it out there in your house every day, and you're a good role model as a parent with your sleep hygiene and your exercise and your healthy eating, your kids will follow and they will go back to it, I promise. And so they don't have to play catch up when they are older and they have medical issues. Let's try to prevent all of those and really raise our kids with these pillars of healthy habits at a young age, because it can really help in so many ways with their health, their brain health, their body health, their gut health, how they do in school. We didn't even talk about school success today,
Yeah.
which is also something so important that so many kids need help with today because they're all distracted and have trouble focusing and concentrating, but it all goes together. And I think those healthy habits when they're young that you really instill as parents can really make a difference in the long run.
I love that. I would love for you to come back so we can talk about the school focus and performance, because I think that's something super hugely important. So we'll set that for another time. But also one last bonus question, because I know you're doing a little bit of a PSA on social media around this right now, again, because we are in peak measles season and here I am in Texas, like things are a little dicey here. You had a message for those of us who were born in the 70s and 80s that we might need another dose of the MMR vaccine. Can you talk for a second about that, just so people are aware?
Yes, in the 60s, there was actually a different type of measles, mumps, rubella vaccine that if you got, it may not have been as effective. So you may need another dose. And if you were born in the 70s and 80s, like I was born in 1972, just to age myself out there, it was only recommended to get one dose then. We didn't start giving the 2-dose recommendation for the vaccine until 1989. So you may need to talk to your doctor. You may need to pull up those old vaccine records, but you can always get your titers checked. I've had a lot of parents coming to my office asking to check those titers. And sometimes you will need that second MMR dose to help make you high enough so you're protected against all 3 infections. And so I think that's really important and something to just check up on. If you have your records, if you don't have your records, talk to your doctor about getting a simple blood test or just simply get another booster dose of the MMR vaccine. It's very safe. And I needed a second dose when I was in medical school. And if you work in the healthcare industry, you probably had your titers checked because they checked all of us back then to go into the hospital just to make sure that we weren't going to infect anyone with a lot of these, what used to be rare diseases that now are coming back and we're seeing again.
Fun. Yeah, everything's retro. Okay. But okay, so yeah, we're getting vintage illnesses now. It's awesome. Thank you so much. This is just such incredibly valuable information, and I really appreciate that you distill it down into very simple concepts that people can adopt and think more mindfully about, because this is hugely important stuff. And obviously, I'm a huge believer in preventative health at any age. So this is super key and cool information.
Thank you, Erica. It was so nice to meet you, and definitely I look forward to coming back anytime.